Thank you, Dr. Agarwal. And first of all, I must thank my colleague, Dr. Praveen Chandra and Dr. V. Puman for beautifully elucidating the various connection between diabetes and COVID-19, and Dr. Chandra how beautifully explained how thrombosis occurs in patients who suffer from COVID-19. I think Dr. Mohan has shown beautifully the connection between the COVID-19 and the severity of the infection and a higher mortality rate in persons who have associated comorbidities. And it has been shown and confirmed that patients with any comorbidity had a poor clinical outcomes than those without. The study from the first of its study from Wuhan, China, revealed that chronic obstructive pulmonary disease, diabetes, hypertension, cardiovascular disease, malignancy like cancers were risk factors of reaching the composite endpoints of admission to an intensive care unit, invasive ventilation, or the death. And Dr. Mohan also told about the increase, the most important comorbidity in the non-survivor from the ICU from the Wuhan was the diabetes, hypertension, heart disease, chronic obstructive airway disease, and the cancer. We all know that data points to an increase in the mortality in COVID-19 with the known hypertension, diabetes, CVD, COPD, and cancer. So it is our duty that special attention is definitely required in patients with COVID-19 with associated comorbidities, including hypertension, diabetes, and established CVD. You know, we have two very recent good articles from our own colleague, Dr. Udesh Kumar Singh and Anup Mishra, where they are given the outcomes in the hypertensive cohort and the controversies with the RAS blockades, which they have beautifully explained that RAS blockade can be safely continued even in diabetic patients. Now, why COVID-19 is a double challenge for people with diabetes? Dr. Mohan clearly explained that uncontrolled diabetes is an important determinant for the severity of the infection. It is not that they are prone to develop COVID. The only thing, if the uncontrolled diabetic develop infection, he gets more severe infection and the fatality rate is more high, primarily basically because of the disturbed immune function. It is not only the innate response, even the adaptive response to the immune response to the immune system is lost. Innate, the inherent immune response when the virus attacks the human cell, the human body, and the adaptive response when you are capable of fighting the disease when it has entered the cell and is showing the symptomatology. So patients with diabetes need intensive attention to reduce the risk of fatalities, and they should follow the general prevention advice to avoid infection with the COVID-19. Analysis of Italian Medical Council has shown that 16.5% of patients who died from COVID-19, 909 patients, the 16.5% of patients were suffering from cancer. So that becomes an important comorbid condition. And again, a pooled meta-analysis has shown the risk of contracting COVID-19 was higher among cancer patients and survivors than the general population, again, because they are immunocompromised. Now, coming to the basic and important question Dr. K.K. Agrawal has told me to discuss, the most difficult topic. We, as the healthcare workers, are on the front lines of the global effort to care for the patients with COVID-19. While putting themselves at risk for the infection, more than 1,000 healthcare workers have already died. A very sorry figure. Given the worst outcomes seen in patients with comorbidities, our healthcare workforce with the underlying disease, whether they are suffering from diabetes, whether they are suffering from heart disease, whether they have associated hypertension, or they are suffering from lung disease or the chronic obstructive pulmonary disease, or they had a previous cancer which they have survived, are at increased risk of contracting the infection and probably suffering from the worst outcome. I like the word of Dr. Kekar Agarwal, the charity begins at home. We are also human beings. The doctors can also suffer with the various disease spectrum. A common notion among the mind of the patients, oh, you are a doctor, you can save yourself. How come you have become sick? We can't believe it. We are also human beings. We can also become sick at any time as all of you as patients. We are not different from you. The only thing, the added quality we are having to treat the sick. And in fact, when the doctor becomes sick, it becomes more difficult for him to get treatment, for reasons, obviously. Now, there are several reports of deaths due to COVID-19 healthcare workers we know from across the whole globe who had an underlying illness. And Dr. K.K. Agarwal told you about the recent, very sorry that we lost our senior AIMS doctor, Dr. J.N. Pandey, because of COVID-19. So I told you, we as a healthcare worker are as precious as the patients they are currently being treated. We have to have measures in place to protect the vulnerable members of our healthcare workforce from this infection so that they can continue caring for patients and safeguard themselves as well. If we are not well, if we are sick, then there will be a big problem for the patient, how they are going to get the dedicated healthcare services from the dedicated healthcare team. Though there are some suggestions what we can do. These are some of the suggestions, observations, recommendation. Every day is a new experience to us. Every day we have some new recommendation. Every day we have a new figure. How many people? Every day we know something that this happened. Ideally, what should be that we should not deploy the younger, what we call the frontline healthcare workers who have recently become pregnant or are having underlying diseases which makes them immunocompromised providers in COVID-19 wards. We never ask the healthcare providers that whether you had history of diabetes, whether you are suffering from hypertension, whether you had some lung problem. So it is obvious that we must also come out, and specifically when you are being posted into the COVID-19 ward, you should always tell that you have to take your health, come out openly that I'm a diabetic patient, I had a lung problem, I had suffered this problem, so that proper care can be taken by you before we take care of the patients. Like a very good, everybody is taking, the government agency are telling that shift the healthcare providers who are above the age of 60 and those who had comorbid condition, which I already told you, to be in direct care of the patient with the COVID-19. Older patient, Dr. Mohan told, Dr. K. Agarwal told that they're also vulnerable healthcare workers and they should be given a chance to treat at a safer distance. These healthcare workers who are vulnerable may be shifted to phone or virtual encounters. We can take help of our senior consultant through virtual telephoning call, the video consultation to the juniors who can take care of the frontline workers to treat the COVID-19 patients, particularly in the critical care wards. Virtual rounds with the senior physicians is very important and could allow the social distancing and ensure continued guidance of our younger colleagues. We have to follow that. We have to do that, whatever may come. Senior physicians could leverage their skills to train others on some of the procedures such as intubation, management of severe respiratory failure, like we have a critical care team which is led by Dr. Chawla, Dr. Kanwar Dej Bansal, Dr. Rosha, who have been training their juniors over the last 203 months how to do intubation, how to manage the acute respiratory failure. So they are doing the good job and they are just behind the curtain to help them. Provision of the adequate amount of PPEs Dr. Chandra told, Dr. Mohan told, which is a huge, huge task. And the government has to come up with this provision of adequate amount of PPEs to protect the frontline workforce because of the sheer number of patients in our country and the number of healthcare providers which has been basically trained and which has been basically treating the patient at present. Apart from that, our psychiatrists should be as the backbone of provision of the psychosocial support for the healthcare profession. It is very important. I have seen many of my colleagues just with the fear of acquiring COVID-19 had not been attending their duties for many months because of their vulnerable population. This psychological support should be tremendous at this time. And what should, as a clinician, as a specialist, we should do? We should protect ourselves. We should minimize our chance for exposure. We should ensure policies and practices that are in place to minimize exposure to the respiratory pathogens. Measures should be implemented before patient's arrival, upon arrival, and throughout the duration of the patient's time in the healthcare setting. We should continue our treatment. Often the doctors are the most vulnerable population, which they don't take medicines at time because of their busy schedule. If the diabetes on multiple doses of insulin, because of his work schedule, he will forget to take one shot of the insulin, which is really very harmful. You have to think that you are also a patient. You have to take the medicines as you guide to the patient. Charity begins at home, again tell you. So you have to treat as the way you are treating patients. Follow standard precautions and communication. Discuss your risk with your treating doctor. Don't hide it. Engineering control is the best way. Consider designing and installing engineering controls to reduce or eliminate exposure. And Dr. K.K. Grawal told the negative pressure right from at the entry when the patient enters into the triage should be effectively adhered to. Implement environmental infection control measures as laid down by the infection control committee of your hospital, and the manage the visitor access and movement has to be done very meticulously. Like our hospital, right from the various door entry, they have been having the thermal scanners. They check every patient before they come in contact with a doctor, and most of the doctors nowadays has switched to the e-consult, video consult to limit exposure to the patient, particularly those specialties where they don't require much of the physical contact or the examination, like endocrinology and so many other specialty. So I have been doing a lot of video consult and everything. With that, my simple I wish and pray that all our healthcare community should take care of themselves before they take care of the patient. Our life is as precious as the life of our patients. We should take care of ourselves. I'm very sorry to say that even in our hospital, I have seen many of my colleagues falling COVID positive. They have become COVID positive over the last 1 month. The numbers are increasing. Is a sort of a very scary figure, and people are really afraid. And we should come out whatever the precautions I have told you. Thank you very much.